Good afternoon, folks. I have discussion A for you today. We're discussing governor secured enormous federal awards from the new 5-year 50 billion rural health fund, rural health transformation fund. But now lawmakers and major health groups in several states are resisting or rewriting those spending plans, even though CMS has warned that significant changes could cause states to lose funding. For rural communities like Crawford County and across Northwest Pennsylvania, these political battles directly influence which hospitals survive, which services expand, and how quickly improvements reach the ground. Why this conflict happens. Why this conflict is happening. The tension isn't about whether rural health needs investment. Everyone agrees it does. The conflict is about who gets to control the money, how fast states must move, and whether the federally approved plans still reflect political realities. Now that legislators are back in session, a massive federal investment, the Rural Health Transformation Fund, is a 50 billion 5-year plan, 5-year initiative designed to establish rural hospital, expand primary care access, strengthen behavioral health, and modernize outdated infrastructure. In late 2025, governors announced hundreds of millions of dollars per state, creating excitement and immediate scrutiny. The state level resistance across multiple states. The article reports Republican lawmakers in at least one state blocked a major initiative that had already been approved by federal officials. A state hospital association successfully pushed to change who has authority to approve spending, shifting power away from the governor's original plan. Other health groups are urging caution, worried that rushing could misallocate funds to create long-term obligations states can't sustain. CMS steps in. The Centers for Medicare and Medicaid Services issued a clear warning. States risk losing money if they make major changes to their approved plans. CMS expects states to implement what they proposed, not reinvent the program after receiving the award. What this means for rural communities. This isn't abstract politics. It shapes real services on the ground, potential impacts. Delays in telehealth expansion, broadband upgrades, and mobile clinic rollouts, slowdowns in workforce incentives, such as rural nurse recruitment or loan repayment programs, uncertainty for small hospitals, which often operate on razor thin margins and depend on predictable funding, shifts in priorities depending on which groups gain control. Some states may favor hospital systems. Others may prioritize primary care or behavioral health. Why Pennsylvania residents should pay attention. Even if Pennsylvania isn't one of the states in open conflict, the dynamics matter because state legislators nationwide are watching each other's moves. Hospital associations often coordinate strategies across states. CMS's enforcement decisions will set precedents that affect all participating states. For a rural region like Crawford County, where hospital closures, staffing shortages, and long travel distance already strain families, any delay or redirection of funds could have outsized consequences. What residents and local leaders can do. Here are some practical grounded steps for communities like Meadville. Track Pennsylvania's official plan. Look for updates from the PA Department of Health and the governor's office about how the state intends to use its reward to engage in local providers. Ask Meadville Medical Center, local FQHS or FQHCSs and behavioral health clinics how the funding could affect emergency services dementia care, telemedicine, workforce retention, transportation, or mobile service. Communicate with state lawmakers. Encourage them to maintain transparency, avoid last minute plan rewrites, prioritize small rural hospitals and clinics, protect funding from political. 4. Monitor CMS guidance. Any new federal notices could signal whether states are at risk of losing funds or whether CMS is tightening enforcement. Okay, guys, that's your A for today. I will be back on with B in a little bit. Gator Wellness. Take care, folks.